Hai, saya Sasha. Selamat datang ke Hello Sihat, apa khabar? Di mana kami ingin bicara dari hati ke hati bersama anda.
Dan saya Dr Fariza, Pakar Perubatan Hematologi, Pusat Perubatan dan host podcast pada hari ini. Sebenarnya saya dan Sasha memang sangat excited hari ini.
Betul.
Sebab kita akan bicara satu topik yang sangat dekat di hati kita orang perempuan.
Betul.
Iaitu imej cantik dan sihat. Masyarakat sekarang dia ada persepsi tau. Kalau nak cantik, kena kurus. Jadi ada orang sampai tertekan dengan expectation masyarakat dan juga social media. Jadi dia ambil langkah-langkah yang ekstrim. Skip makan, diet yang ekstrim ataupun ambil ubat kurus.
Betul.
Jadi hari ni sebenarnya kita nak buat perbincangan secara umum dan berdasarkan pengalaman peribadi kita.
Ya.
Jadi hari ni saya sangat excited sebab kita ada seorang tetamu yang sangat cantik dan sangat berkaliber dan kepakaran dia adalah dalam topik inilah.
Betul. Jadi untuk mengupas topik mengenai ini dengan lebih lanjut sebab banyak yang kita nak bincangkan selepas ini, saya ingin pertama sekali memperkenalkan tetamu kami hari ini, Dr Malathi Karupiah.
Hello.
Pakar Perubatan Dalaman dan Endokrinologi. Salah sebut. Saya sebut doktor ni?
Endokrinologi.
Doktor belik lidah. Daripada Pusat Perubatan Prince Court. Jadi Dr Malathi, dia bukan yang just anybody, okay? Special kita bawa hari ni. Sebab dia pakar, dia mendapat ijazah sarjana muda perubatan daripada Universiti Manipal, Melaka pada tahun 2006. Ijazah sarjana perubatan dari Universiti Melayu, ada lagi? Dan diploma MRCP dan SRCP. Wow. Dari Royal College of Physicians, United Kingdom. Fantastic. Fantastic. Okay. Jadi kepakaran Dr Malathi adalah di dalam rawatan kencing manis, penyakit endokrin thyroid dan adrenal serta penyakit obes. Wow, those are pretty heavy.
Tapi very relevant.
On its own. Yes.
Yes, very relevant.
Jadi pertama sekali, apa khabar Dr Malathi?
Thank you. Thank you, Sasha. Thank you, Fariza. Thank you for having me. Terima kasih. Firstly, congratulations on this podcast to both of y'all.
Thank you.
Sangat-sangat terharu saya ada dipanggil untuk berbicara tentang satu topik yang sangat-sangat penting bukan kepada saya saja. I think it's to all the public.
Yes.
Yeah. So yeah, I'm very excited.
Jadi actually saya dan Dr Malathi dah kenal sebab kami rakan sekerja. Selalu lari sama-sama. Jadi saya rasa perbualan ni sesuatu yang the timing is good because I need to make sure that masyarakat dapat extract some information tapi dalam dos yang berpatutan sebab topik ni sebenarnya berat. Cantik, nak cantik, nak kurus, nak sihat. Jadi sebenarnya saya rasa masyarakat dah tahu kalau kita ada penyakit, kita harus mendapatkan rawatan yang sejajarnya daripada doktor yang bertauliah. Namun disebabkan dari segi pendidikan dan sebagainya, kita sekarang lebih aware. Janganlah nak tunggu sakit, kita kena cegah.
Betul.
Cegah penyakit. Tapi orang kita bila cakap tentang pencegahan penyakit, topik yang selalu keluar ialah faktor pemakanan. Jadi bila kita jaga makan, kita kurus. Bila kita kurus, kita sihat dan kita cantik. Jadi apa pandangan Dr Malathi tentang notion nak cantik, kena kurus dan dah kurus tu sihat? Apa pandangan you?
Okay, so firstly, I nak just inform that this is timely that kita berbincang tentang topik ni because just yesterday kita baru launch dengan Minister of Health about obesity. How it has been recognized sekarang sebagai disease, chronic disease.
Ya ke?
Yes, so it's just not sekadar kencing manis, darah tinggi, kolesterol yang tinggi, tapi juga obesity.
So dia satu penyakit sekarang.
Sekarang dah satu penyakit.
Aduh.
So kita dah tahu obesity ni is like an umbrella and then dia menyebabkan banyak komplikasi berlainan sebagai kencing manis, darah tinggi. So sangat penting untuk kita address the root cause of everything.
Yeah, okay.
So instead of just talking about complication, I think kita kena also dive there in and talk about apakah yang menyebabkan komplikasi-komplikasi ini.
Kita boleh cegah.
Yes.
Yeah.
So untuk answer your question, Fariza, about pandangan public kan, mereka ingat kalau kurus is sihat. It's not. Sebenarnya kalau kurus pun banyak pesakit kita ada tengok ada banyak metabolism problem sebagai kolesterol tinggi, kencing manis pun mereka ada. And sometimes they tiba-tiba dapat serangan jantung. How is it? And penyakit banyak pesakit datang tanya kurus. Tapi saya kurus kenapa? Doktor cakap kencing manis, kenapa cakap kolesterol tinggi kan?
Like, kita banyak dengar cerita macam orang yang pergi jogging, tiba-tiba they collapse.
Yes.
So like, aduh. Hey, you lead a healthy lifestyle. They go for jogs, they run, they go to the gym.
Aktif.
They collapse and then,
Yeah, so saya rasa I'm sure Fariza, you see it also. Banyak public doesn't come forward. They scared. They are actually scared of us. Sebenarnya kita doktor nak tolong. Kita sebenarnya kat sini bukan nak takutkan mereka. It's very important sekarang untuk mereka buat pantauan darah. As basic as just looking at their blood results. Kalau nak tanyakan berapa umur saya kena start untuk buat pantauan ni, actually nowadays even after 2020 also, I think sangat-sangat important, penting untuk mereka datang buat pantauan at least once a year.
Macam medical check-up.
Medical check-up. Atau kalau you ada risiko-risiko tinggi sebagai family history, kalau family ada kencing manis, darah tinggi, serangan jantung, itu memang
Jadi kena datang check out.
Tak semestinya kalau you sendiri ingat yang saya kurus, saya tak payah check apa-apa. Orang tak faham kita ada banyak lemak bukan kat luar saja tapi dalam organ-organ kita.
Yes.
So maybe you might not be nampak macam obese
Dari segi luaran tu,
from outside you don't look like it, but actually when you do your bloods you akan nampak lah kolesterol tinggi semua. So I think kalau nak cakapkan kurus doesn't mean it's healthy. It's not about nak nampak cantik sekarang. Sekarang kita nak pastikan orang sihat. Sihat sekarang saya rasa akan membuat you nampak cantik rather than you being just skinny and thinking that's what it is.
Okay, jadi isu berat badan, kita banyak bincangkan tentang isu berat badan because I face that issue also. I think I speak on majority of many women, but we try our best and seolah berat badan ni satu pandemik dalam masyarakat kita. Sometimes you feel like it's a never-ending battle. It's like you try all kinds of things.
tapi tak kurus-kurus.
Berat badan, I understand yang saya faham berat badan yang tinggi berdasarkan bacaan BMI yang tinggi. Betul. Boleh berlaku atas gabungan gaya hidup moden, makanan segera.
Yes.
We're all guilty of that once in a while. It's unhealthy, processed food, because we all lead busy lives. Comfort eating,
Betul. Stres je makan
ice cream.
from ice cream.
Jadi bila kita stres dan gaya hidup sedentary.
Tidak exercise.
Jadi apabila berat badan kita berlebihan pula, apa sebenarnya kaitan berat badan dengan penyakit berat badan seperti penyakit kencing manis, diabetes, kolesterol tinggi, serangan jantung dan so. And I'm sure it's a much longer list sebenarnya. But those are the ones that is often talked about sebenarnya.
Excellent question, Sasha, actually. So, apakah kaitan berat badan dengan komplikasi yang kita dapat? So, kalau kolesterol tinggi, it is because kalau berlebihan lemak dalam badan, what it happens, it goes and sit in all your vital organs seperti jantung, your hati, and of course saluran-saluran darah kita. So kalau tekanan darah tinggi sebab saluran darah semakin tebal, semakin sempit. So that is going to cause you to have high blood pressure. Then if you talk about serangan jantung, that's because of whatever I mentioned, kolesterol tinggi, tekanan darah tinggi, that's just going to keep you in a high risk of also developing a heart problem. Nowadays kalau tengok kan banyak orang fikir hanya masalah genetik. Kalau saya ada masalah genetik, that's when I'm going to get it. Actually no, and you rightfully have just mentioned it. Now pemakanan kita semua dah is all processed. Most of it is processed. It is not as how we used to cook last time. Now Grab food is so apparent everywhere. And most people kita sejak our COVID lockdown, right? So what people started doing, they found comfort in sitting down in the house and just with a touch of a number, touch of an app, semua deliver. So untuk orang to move around also it has all reduced. So that's why now if you look at the numbers, as yesterday we mentioned in the press conference also, that it's literally 30% out of our whole Malaysian population is obese.
30%.
30%.
That's 1/3.
Yes.
That's one
third. And it's like literally we are the highest number in Asia, Southeast Asia. It is very, very scary. Hence why nombor-nombor untuk your statistics for kencing manis, darah tinggi, serangan jantung, semua semakin naik. So again, it comes back to the root cause. So that's why now we're trying to move this, this whole, awareness, trying to make people understand that penyakit obese ni is real. It's not just about image anymore. And what I think is so important for us all to understand, I don't think people should feel scared. Like you started off in the beginning, banyak orang takut kan nak cakap tentang this issue. Just as simple as today in my clinic, one of my patients was referred to me, and she didn't fill up the form. Usually I give my patients form to fill up like a questionnaire. Tak tulis apa-apa. Bila I tanya kenapa kan, dia, so shy.
They're
so
conscious.
conscious. Then I say, so I kind of knew already. I say, is there any weight issue would you like to address? Baru dia cakap, yeah, actually doktor saya ada, masalah untuk turunkan berat badan. So I think a lot of people are scared to come forward because they feel that they are going to be stigmatized. They are going to be told,
Could be judged.
Yes, judged. So I think it is changing the mindset. It's not only just the patient, but it's a ripple effect. It's also the family, the spouse. It all starts, I think, also from home. So I think this podcast is fabulous. It's just giving so much of awareness to public that come forward. Nothing to feel shy about. These are treatable. You can get medication for this.
Jadi, very good keyword there, Malathi. You mentioned there's a medication for this, which takes me to my next question. But also now dalam kepala I pun dah ting dah macam soalan lagi I nak tanya you. Because this is good because some information we know, tapi bila kita nak bagi tahu kat public, dia rasa takut nak datang. So I hope this is a safe space untuk kita bridge that gap. Jadi bila Malathi mention there is a medication for this, so it's very timely. Kerajaan telah mengenal pasti obesity sebagai satu penyakit. Jadi bila ada penyakit, dan orang akan cari rawatan. Okay, isu dia sekarang, kadang-kadang masyarakat kita ni terlebih aware.
Betul, dengan AI sekarang.
ChatGPT, apakah rawatan?
Fariza, I was going to ask, we have two doctors in our house. So I was going to ask, but how do you feel about kalau, for example, I'm obviously not a doctor, but before I go to see a doctor, is it recommended or is it okay for me to Google to find out myself what are the symptoms and because maybe I'm worrying at night, I'm not sleeping at night, I'm worrying about all the symptoms I already know, but I don't want to go and say maybe because of cost, because of insurance or whatever other issues, but I Google it.
Tapi denial.
That's other friends. So what do you think, Dr. Fariza? What do you, doctor? Is that okay to before we go and see doctor?
Maybe saya bagi komen sikit lah sebelum kita pass the mic to Dr. Malathi balik. In my opinion, actually it happens to my clinic also. Patient Google or ChatGPT and cakap saya dah consult AI. We cannot do anything about that because that's the era of digital technology right now. However, AI dia punya kebaikan atau kelebihan ialah dia ada database. Namun database dia tertakluk kepada keyword yang kita letak. Some database dia ambil daripada general search ataupun bila kita letak keyword spesifik dia akan ambil daripada guidelines. Jadi bila kita ambil macam benda carian umum, still you have to take it with a pinch of salt and still kena consult pakar.
Of course.
Jadi pandangan you.
Betul. I agree with you 100%. Saya rasa kalau, it's going to happen. We have access in our palm, our handphones, right? Semua orang akan cari what's the next step? Siapa saya kena jumpa? Apa yang saya perlu buat? Semua mereka akan cuba. Now, of course, let's address what is not being spoken very openly also is the fact that there's a lot of false information in TikTok and Instagram about a lot of slimming products, a lot of natural products. Now, bila pesakit-pesakit datang jumpa, I'm sure you also get it. They ask, can I try natural product? To me, I feel that I'm not going to say no. It's your prerogative, tapi be careful. We don't know what is in the content. Now, come back to about the medication part. These medications have been researched and we have been educated and mereka dah beritahu kita apakah kesan sampingan tentang ubat-ubatan yang kita ada sekarang. So, I think we know what to expect. And I'm not saying that our medication tiada kesan sampingan dia. Memang semua as simple as makan vitamin C pun. Some people can actually develop dehydration. You know, a lot of other side effects if they take too much of vitamin C. So I think the concept is orang kena faham apa-apa yang kita makan, as long doktor beritahu apa kesan sampingan yang perlu dipantau, then they will be more alert and come forward before anything that happens. So I think AI, ChatGPT, like you say, is database, but they're not going to tell you everything, you know, so must come
You
forward.
still need the human touch.
You need human touch.
Yeah.
And about obesity, the other thing I want to say about treatment also, it's not just medication, it's 3 things that I always try to set the stage dengan pesakit saya. Tentang your emotions, emosi,
Yes.
physical, and also your mental health. Like it's a huge mental health that needs to be addressed, and that's something also not many people talk about it, because again it comes dia datang balik kepada menjadi stigma. Banyak orang tak nak address benda-benda ni, dia takut pergi kepada mak bapa. They're scared to go to their spouse. They don't want, because they feel, oh, I'm going to be stigmatized. Mental health needs to be addressed, because that's another factor that causes obesity. Comfort eating. People are stressed. People are upset. Anxiety. Apa yang mereka buat? Makan.
Makan tu macam kawan dia.
Yes.
Bagi dia comfort.
Yes. It gives us the sugar rush, isn't it? And it makes us feel happy. Comfort. So you don't get the external comfort. Where do you go? You makan. You feel internal comfort.
Jadi boleh dirumuskan di sini, kalau nak rawat obesiti, eloklah pesakit mendapat bukan saja ubat suntikan ataupun apa-apa untuk kurangkan berat badan tu, tetapi di tempat yang ada facility untuk pesakit tu berbicara tentang emosi dia juga, in a safe space.
Yeah. So I think about all this medication and all that. Number one, macam mana, okay, for instance myself, I do treat all this, pesakit yang ada obesity. What we do is we do basic evaluation. Kita ambil history dulu, kita then do blood test, because there are other hormonal issues yang boleh menyebabkan obesity. Hanya bukan pemakanan saja. So saya nak public also understand that I don't want you to feel that, oh, it's my fault, I'm not doing anything. It's my fault that people think I'm lazy, or, at the workplace, people might say, oh, you're not trying your best. A lot of people, I have to give them credit, mereka cuba. Now we have got so many parks in Malaysia. Let's not talk Malaysia, Kuala Lumpur,
KLCC Park,
Pelawati Park, KLCC Park, you have in Putrajaya. A lot of people, as you see, the numbers are increasing, they are visiting these places. But then they come to me and say, I dah cuba semua, tak boleh. So now, then come back to, medication. So I think it's very important we address apakah hormone issue yang mereka ada. Once we've treated that, and they don't have that, then we look if they are diabetic. Now, ubat-ubatan ni sebenarnya asal dia ialah ubat-ubat untuk kencing manis. That's the first thing.
Itu kalau sebenarnya ubat tu sebenarnya untuk, the reason why you're supposed to take it is for something else, but you're using it. So how does that work?
Yeah, so sekarang sebelum ni kita ada ubat, okay, nama dia is very scientific lah, semaglutide and teriparatide. The new one is a teriparatide, is a combination of 2 things. So dia fungsi dia, it mimics one of our enzyme that we don't have. So when kita dah obese atau kita dah ada masalah kencing manis, kita tak ada that enzyme. So what happens is kita makan. So now ubat ni sepatutnya try to kurangkan our appetite. At the suppress appetite, and the second thing is it also actually works at the level of increasing your insulin. So masalah obesity ni sebenarnya menyebabkan insulin resistant. It's a common term that a lot of people use it. So what happens is badan takkan menyerap insulin, menyerap gula ke dalam sel. So terlalu banyak gula dalam darah. So insulin, it becomes it doesn't work at its maximum to bring down the sugar. That's where diabetes happen. So what does this medication do? It brings down the sugar actually. So semaglutide is actually what's the very famous one everybody is talking about. So it's once a week injection and people are taking it. But sometimes I have to be honest, it's being used wrongly. So you have to find the right doctors to actually administer that medication and tell you how to take it. So again, my emphasis is it's a diabetic medication. Tapi what they found out is it causes weight loss. So how did we start with this? So it started with obesity being the umbrella kan, plus to all its complications. So now they've come up with also another new drug that helps with obesity. So once you tackle the root cause, everything else kind of like falls back. So this is what actually the medication is for. It's not just purely to look good. So be very careful. That would be my message to public, that be careful. jumpa dengan doktor yang betul. Pastikan doktor memberi your nasihat yang betul and also memberitahu kesan sampingan. If I talk about kesan sampingan, it's quite apparent. Mereka akan rasa macam, they feel full, feel like nak muntah, and then they feel that as if like, everything slows down because that's how the medication works. And then some people have sembelit juga. So that's why you must be careful on all this. So that's why the way we give the medication pun, kita akan start dengan low dose, pastikan you're okay dengan tu, dan baru kita naikkan kepada yang tinggi. So be careful kalau nak ambil benda-benda ni. There is side effects, I'm not denying it, but it's a very good medication to
Be aware basically.
Yeah.
Tapi sebenarnya macam saya ada kawan-kawan yang ambil, bukan saja di Malaysia tapi di Dubai juga. Tapi mereka ambil memang untuk they are slightly overweight, and they take it from the doctor. They went for their checkup and everything. They went through the right channels. Tapi saya juga ada dengar ura-ura gossip. Oh, you can get it from this person cheaper. You can get it from, pakai cable, as they say. To me, that's worry.
Yeah.
Because you don't know the source.
Ubat tu
So this is serious stuff because and my other question was going to be, let's say kita start ambil yang suntikan ni kan. Sebenarnya dia duration ni berapa lama? Is it for life? Because I also heard some of my friends that took it, after they stopped taking it, whatever the time they take it, their appetite actually doubled and they put on the weight even
rebound.
Yeah, that's true. That is very true. You do have a rebound effect once you stop the medication because the main effect of it is it suppresses your appetite. So imagine if I take it away from you, your appetite comes back and you start eating.
Come back with a vengeance.
They come back with a vengeance. So what we are trying to tell public is sustainability. We want to achieve sustainability. Now, to answer the question is, kencing manis, darah tinggi, semua ni adalah pesakit yang seumur hidup. It's treatable, but it's not something, it's like a life sentence. It's something boleh dikontrol, your complications. So walaupun dah develop, something that can be arrested. It will not progress. So that's what we are aiming. Nowadays, medical field, as you know, we are moving towards prevention rather than cure. So we're trying to prevent that. Now, kalau ubat ni, kalau saya ambil, adakah untuk seumur hidup? There is no data in how long this medication is supposed to be
It's
there.
brand new, right?
Yeah, it's been there for quite few years already, I would say. But the research is still ongoing. But what we've seen the rebound effect. So what we tell patients is, yang penyakit obesity and kencing manis semua is a lifestyle change. The foundation of all this is lifestyle, meaning diet and exercise. We cannot run away from it. So walaupun pesakit saya datang, saya kasih ubat ni untuk mereka, saya akan cakap, from the beginning itself, it has to be a lifestyle change. You must understand, you have to change your way of eating, you have to change your exercise, but at the same time, I don't like forcing. I don't think, I would not like anyone forcing.
So awareness kena ada.
So I tell them to choose what kind of exercise you're like doing. At the same time, I just give them awareness and motivation. I think that's probably just what they need. And I feel once they see their friends or their spouse, I love it when, husband and wife comes together or family comes
Support
together.
each
I
other.
actually have a friend where husband and wife were doing it together.
That's good.
And they decided they wanted to get healthy. They asked slightly overweight.
Yeah.
And they recognize that, and I think I've seen the change. So yeah, it's when you're doing it for the right reasons. I mean, not to say it's a minority or the wrong reasons, but sometimes it can seem like a shortcut way that they want fast results. To me, that can be a bit scary because to get fast results, sometimes you go shortcuts.
Yeah. So that's why it's very important. I think the other thing we should address also is the fertility issues. So apparent now. That's a big topic on its own. So I do get a lot of fertility patients coming and all that. So weight, obesity, itself is a key factor to that.
Yeah.
Obesity, as we know, is also a key factor for cancer as well. So it's a big topic, as you say.
Branching is
Branching everywhere. Yeah. And then now cancer of the liver, fatty liver. So that's another research that's ongoing as well. So yes, the medication is needed rightfully where it's needed. So I think just having the awareness, asking the right answers, questions, and seeing the right people, yang tu yang paling penting I feel for the masyarakat.
Mungkin masyarakat dia dengar kita cakap pasal obesity kan, BMI. Some of these words mungkin a little bit technical kepada pendengar. boleh tak Malathi explain bila kita kata obesity tu bukanlah kita nak body shame orang ke apa kan, tapi dia ada definisi. Boleh tak you just macam explain kat pendengar apa definisi obesity? Ada mathematical calculation ke, ada formula ke, ada ke angka yang mendefinisikan yang ini tak obese, yang ini moderate obese, yang ini morbid obese.
So memang ada. I mean, if I were to go into that, it's very medically inclined.
Tak apa, kita dengar je. Kita nak dengar sebab kita nak sampaikan masyarakat ni.
Kita guna BMI kan?
Ya,
Body
BMI.
mass index. So
Yeah.
it's calculation of weight and height. Tapi sekarang we are moving away from using body mass index already, BMI. Kenapa? Because nowadays a lot of people have bodybuilders. At the same time, you have people who are, they are just genetically just very, very skinny.
Yeah.
And then you also have patients who they have just big bones. They call it big bones, right?
Yeah.
So because of that, sekarang kita tak nak put everyone, your BMI is this, means that means you're in a class 1 obesity. The obesity pun kita dah classify 1, 2, 3 and then morbid obesity. Morbid obesity means that means your BMI is literally more than 40. That means this is something that really, really needs intervention, where later probably we'll talk about surgical intervention rather than just medical therapy. So this is how we classify patients according to your BMI. But nowadays we are also looking at waist circumference. So if it's more than 90 cm,
Abdominal circumference.
abdominal circumference for males, it's already overweight.
Apa tadi?
90. 90.
So lelaki ada measuring tape. Boleh beli kat Daiso. So kalau lelaki perut dia 90 cm itu obes.
Already obese.
89?
Almost there. And then 80 and above.
Warning. Yeah,
Warning lah.
lah.
80 above is for females.
So,
I mean, we know already like 80 above. The child, all of us are like, what is my,
Sekejap lagi
yes, like the adore. So yes, I always tell myself, doctor yang, talk about obesity, I'm like, oh my God, I'm also, a woman. I'm also going through my changes in hormones and all that. Tapi we have to I think this is just realization. Kita learn from our patients. I'm learning from my patients. So it's a two-way interaction, actually. Walaupun I'm here with this talk and all that, I think all of us are learning from each other. I think that's why it's so important.
Yes.
Yeah.
Maybe just lightly touch on people who go through like surgery, like
Bariatric surgery.
yeah, those kind of things. Because I think that's pretty drastic when somebody needs to go through. And what's the other one? They letak ikat balloon.
A balloon, yes, endoscopic balloon.
Yeah. So how do you, as a doctor, how do you like decide?
Which patient gets which treatment?
Yes. Excellent question. I think this is something that, we are seeing happening as well.
Yeah.
Now, it's again based on, number one, the body mass index, the BMI, and also what complication. Apakah komplikasi yang, apa sakit ada? Adakah kencing manis, kolesterol tinggi, atau serangan jantung juga. Now, the BMI, it depends. So, 23.5 above is overweight. Okay, so if they already have anything above that is overweight, but 27.5, if I were to get numbers, plus no comorbidities, that means that is already obese, class 1, 2, 3. Now, these are the category of patients we give medication first, 27.5. Remember I mentioned about morbid obesity? Yes, and who needs robust treatment, meaning if they have kencing manis yang terlalu tinggi atau memang ada banyak medical problem, and then if they are really fit, we speak to them, first give them medical therapy, and then we refer to the surgeon. Nowadays in Malaysia, we actually have so many ways of doing surgery. We used to have the open sleeve gastroplasty, meaning dia akan kecilkan perut. Yes, they'll make it reduce so that you eat also, it kind of like keeps you full. So you can't eat much.
So how is that done actually? I mean, as a non-medical person, I can't imagine. So how do you sew it up?
Yeah, so it's basically sewing it up. They kind of cut it and then they sew it up. So last time it used to be open. Nowadays nobody do open. It's more of laparoscopic. So apa mereka buat, dia akan tebuk and they use like a robot like that to stitch all this. So this is unique. Kena find for high volume surgeon, we call it. Meaning orang yang memang pakar buat ni like everyday kind of their job.
And I've also heard staple also.
Gastric surgery.
Yeah, gastric stapling on, but nowadays we don't do that much. It's more of the sleeve gastrectomy. Again, this is based on research because kita ada nampak risiko untuk apa-apa keburukan berlaku is lesser with sleeve gastrectomy. And then now they have endoscopy sleeve gastroplasty. What it means is they don't need to tebuk anything. They're doing all the stitching is through a gastroscope. Like you
Ikut kamera, masuk ke mulut.
camera, like you doing like you go for gastric, you do a gastroscope, right? So it's the same thing, but it's just a surgical intervention through that. And it's so fast nowadays. They can do it. It's a daycare procedure. Tapi again, there is criteria untuk pesakit-pesakit ni. Siapa yang boleh buat this surgical procedures? Who goes for medical therapy? Throughout the board, actually, we always start with medical therapy first, and then we give them surgery. Even the surgeons use the medical therapy. So it depends on the patient. So if I would just say, on a broad spectrum, it's very important how we classify our patients first. Who goes for what? And of course, it's always like an informed decision. Kita kena berbincang dengan pesakit, tengok apa yang mereka nak. Preference also.
Tapi sebelum buat any surgical procedure, which is any operation to treat the obesity, adakah semua pesakit akan dirujuk kepada counselling atau psychiatry ataupun tidak?
So the term is multidisciplinary team approach.
Yes.
So selalunya dekat our hospital also we actually have a team. So you need a good team because it's a long journey.
Holistic.
It's a holistic approach.
Yeah, it's like
So kita perlu first is making sure darah semua okay, kencing manis okay, control darah tinggi okay, and then pastikan your do ultrasound. Ultrasound also untuk tengok your liver size because lemak-lemak yang saya beritahu ni it will go to the vital
Dia
organ.
meskap dekat liver.
It goes and be there. But during surgery, we want to make sure that liver size also is reduced so that there's no complication. So it's a whole process on its own. It's not as easy as, okay, I feel like doing bariatric surgery, I'm going to do.
Yeah.
So at the same time, bila dah buat surgery ni, kita akan follow up with them. Because again, bariatric surgery pun boleh rebound.
Yeah.
Your stomach is a muscle. It will expand. And people tend to adapt to just not only liquid diet. They'll start knowing what to eat. So liquid diet means they can go and have even orange juice. They can have Fanta. They can have so many sweet drinks and their calories will go up.
Yes.
Even though it's just not solid. So that's why it's so important for them to follow up with good dietitian and psychiatry as well. Why psychiatry? Kerana mereka akan rasa like very depressed. So we are very careful also which patient go for it. Patient yang memang dah ada apa-apa mental issues or anything, we screen them first. Because what is their way of making themselves feel better is comfort eating. So you imagine if
So you take away the thing that they love.
Yeah.
So walaupun dah kurus, dah cantik, tapi sedih.
Yeah, sedih.
So diorang tak ada quality.
So
Kira pun.
again, the stigma, right? People ingat, I'm going to see a psychiatry or counselor means I
Lagi satu pula kat situ.
So it's not. It's actually support system. So it's a whole multidisciplinary approach kalau kita nak buat apa-apa, intervention for weight loss in regards to, patient going for bariatric or anything.
So bukan setakat nak treat obesity, bukan setakat nak kurus, tapi biarlah hidup tu berkualiti.
Yes.
Okay.
So kita topiknya hangat hot. Kita baru kalau ikut skrip ni kita baru tanya dua soalan. Okay, so ikut tapi kita teruskan ni man. But yeah, that's like really really good. I mean, I've learned a lot of things already about obesity. But moving on, kita bincangkan tentang another very important topic. Bagaimana pula dengan faktor tidak keseimbangan hormon? Atau premenopause dalam kenaikan berat badan. Adakah semua wanita dalam fasa premenopause akan mengalami kenaikan berat badan? Atau hanya sebahagian? Dan apa pula komen doktor tentang rawatan HRT? I don't know what. I'm not... membantu mengawal berat badan atau ia hanya melegakan simptom lain untuk premenopause?
Sasha, that's another sangat-sangat hangat topic. It's like obesity is what
We're not finding our age, but we want to know.
Yeah, I mean we are all at that age already, and we are women. We I think this is just empowering each other.
Basically, like I said, for me, like because I don't have a medical background, jadi banyak benda-benda yang kalau saya tak tahu, saya akan Google. Tapi saya muskil sebab like you said, we don't know what on internet is right, what is like could be somebody's opinion, you know.
And then it was quoted by ChatGPT.
Yeah, but sometimes for our peace of mind, for example, like for me, for my peace of mind, I Google because I was like, okay, maybe I'm okay. I'm still okay. I'm still all right, you know. But actually, by right, like you said, the best is to go and see a doctor and discuss if you have any symptoms or whatever it is. Yeah.
So, excellent question again. I just feel that, that is again my specialty, hormones. Now, perimenopause atau menopause, apakah definasi? It's all clinical diagnosis. Sebenarnya tidak ada apa-apa darah yang kita boleh actually look at it to say. But nowadays we are doing all the blood tests to eliminate any other causes. Now, definasi untuk perimenopause ialah orang yang dalam age 40 to 50. We take an average age of 50 for menopause. That's international. Tapi 10 years sebelum 50, that is 40 to 50, nowadays they're pushing it even down to 35.
Tapi tengok I.
Janganlah, kita semua perempuan kan sama nombor sama.
I'll be 60 next year.
It's okay. Yes, 50 is the new 20, I would say.
Whenever people ask me my age, I don't mind sharing my age because I think
You look good.
I'm still here.
Yeah.
Positive side of it.
No, you look fantastic.
We get second chance at life, but we have experience this time.
Yes, that's true. So menopause is, that means untuk 1 tahun dah tiada dapat, your period basically. Perimenopause is that you're still getting monthly your menses, except you have tanda-tanda signs yang sama dengan orang yang menopause. Now, the one thing commonly all my patients will say, I won't be surprised if you all tell me the same thing, because I also am feeling it already. There's something different. I don't feel the same anymore. That's the common thing that everyone says.
I feel like that every day.
For me, I feel okay, but for me, the only thing is the weight. Because I think I'm so used to having high metabolism rate since I was young.
Oh, I see.
And it's like,
Metabolism is slow
it's
down.
stagnant now.
Yeah.
Even though I go to the gym, or that for me is issue. But I think for different women, they have different issues. Because I know some of my friends say they have hot flashes, which I don't. I've never had hot flashes.
Yeah, aircon bilik I 16 tau.
Yeah.
Aircon bilik I 16.
Tapi you rasa panas?
Yes. Adakah?
Kita check hormon boleh sampai.
Tapi kena itu dia husband. Dia beratnya swing tak? Sorry kan?
Selalu kena tanya husband. So yes, kalau nak cakap kalau obesity and your perimenopause are interrelated, sebenarnya it's not all. Like you say, it's individualized. Some women mereka rasa okay saja, tak ada rasa apa-apa because they're always maintaining a healthy lifestyle. They're doing the exercise, they're going to eat healthy food. Now, when we talk about healthy food, so I'm very careful dengan pesakit-pesakit saya because your healthy food might not be the same as my healthy food. So, talking about healthy food meaning we are cutting down on the carbohydrates, not eliminating it, but also, sort of taking out sugar wherever we can and doing high protein and, having a good amount of fat in our diet. So if we talk scientifically, suku-suku separuh, that's what we want to achieve. Suku-suku separuh.
You have to remember that.
Malaysian healthy plate.
Yeah, Malaysian healthy plate. The separuh is not nasi Kita punya separuh selalu ni nasi dekat nasi.
Bukan satu pinggan ke nasi. Whole plate is rice.
Yes, we are all nasi people, right? We love our
So Malathi, apa yang suku? Apa yang suku? Apa yang
So
separuh?
suku is protein.
Okay.
Suku tu, daging satu suku tu nasi. So easier way is genggam. Satu genggam lah nasi.
Tapi
Okay.
kalau cheat day,
Depends. No, that's right. Cheat day is very scary because cheat day means the whole day you can be eating. So sometimes I tell my patient, okay, cheat meal is something more practical. Yeah,
Boleh lah.
Boleh lah. Cheat meal, okay. You don't need to eat the whole day, Yeah. Unless you have really, really worked out, you've cut down your calories, you've seen the weight loss happening. Why not? We are supposed to have life, right?
Enjoying lah.
We doctors, we always say life is like our ECG, our heartbeat, up, down, up, down. So enjoy life. So I will tell my patients, you've achieved your goal, please enjoy life, go and do what you want. But have at the back of your mind that rebound can happen, relapse can happen. So just be more mindful. So not all women that goes through perimenopause akan naik berat badan. Some of them because they already have that sustainability of their lifestyle. But what we see is then we look back, okay, why? We have to really go into their meals. They have to go into their lifestyle. So like I mentioned, it's physical, emotional, and mental. All three of this if one disconnected, your weight also can be affected in many ways because you're trying to find ways to comfort yourself in all three matters, and of course spiritual at the end.
Yeah.
Yeah.
I noticed, I think it's also genes also, no? Because I see some of my friends who are, they are, I don't want to use the word skinny, tapi kurus, tapi memang sebab their body structure is like that. And they always say, if you want to know what you're going to look like later in life, look at your mom, right? My mom is beautiful. She's beautiful, but she has, what did you call it? Child rearing hips, and let's put it that way. So sometimes you can't run away from that.
Yeah.
But like I think that at the end of the day, we just want to be healthy.
Yeah.
But sometimes you do have to accept that when you're going through perimenopause, when you're going through, there will be changes.
Yeah. So that's why I just think it's very important that we know that there's such thing as perimenopause, there's such thing as menopause, and be ready. I think even it's a note to myself to embrace menopause when
It's
you know
natural.
yeah, it's natural. It's a part and process of aging, and we have to just embrace it. I mean, we've seen 55 years old, 60 years old women looking fantastic.
Hell
In even in our hospital. So I think when we speak to them, it's just having a healthy diet, healthy lifestyle.
Positive outlook on
Positive, yes, very important. So it's like, your mental health should be really, really up to as much as
Just take a deep sigh. We were like,
she had an aha moment probably.
Yeah, because being doctors, I have to know guidelines.
yeah,
I kena tahu what's the latest evidence-based method.
yeah.
And when people ask me questions, I kena jawab based on scientific evidence. But what Malathi is also raising the point of spiritual,
Yes.
positive outlook. And benda tu senang discard
Yes.
bila kita nak chase all this other things in life. Kita nak kurus, kita nak cantik, tapi kita punya spirituality ke laut, I mean, I'm guilty of that as well, because bangun tidur je you dah kena buat kerja, you kena buat tu, you have responsibilities, you have tasks to do, you duties to attend, and then you forget actually ada benda tak di-address lagi, which is your soul, so you kurus macam mana pun, you cantik macam mana pun, but dalam
You're not
very
happy,
fragile.
or you're like,
Yeah.
yeah.
And then also, just to add on to the positive outlook, it's just from my personal reading, my personal opinion about this. There are some people who actually, as they go through menopause or as they go through aging, actually they look younger. But not younger in the aesthetic sense, tapi they look more spiritual, youthful.
Yeah. There's a glow. Yeah, there's a glow.
But then the purity of your spirit become more in touch with your nature. Macam tu lah. But for me, macam because we as doctors, we selalu cakap benda technical. Okay, you and me, we talk technical things, definitions, guidelines. But there are another aspect of health, which is sometimes orang cakap, doktor tak cakap benda ni, maybe just a psychiatrist or counselor cakap. Tapi as physicians,
I totally
betul tak?
I feel that now.
Yeah.
It's so important kita kena berbicara dengan mereka because we are dealing with human. Like rightfully you just say guidelines are guidelines. It's all done on the research basis. When we present our cases, when we give talks, right, I always talk about real world case. When we talk about real world case, that means what's in front of me. And
She's a human being.
Yeah, it's individualized. That's why if you realize, I always say it's individual. Kita tak boleh buat semua guidelines sama dengan semua orang.
Semua orang pukul rata tak boleh.
Oh my God, Dr. Malathi, I so agree. Okay, I think for me, being a public figure, in a public eye, especially social media now, it's like you're just open to criticism, and I think I can deal with it so far, but because I think I grew up a lot in front of the public,
Scrutiny.
and so when they see the changes, they feel like they still want me to be the same
Like this.
size or the same and everything as before, but obviously I can't stay forever 18 or ever 20 something, but to me the most important thing I think is a support system, is our friends, our family, spouse, and they say, no, you need somebody to say like, I love you the way you are, I love you the way, so I think that's very important as well. Of course, like I said, as a celebrity, I appreciate my fans and their opinions and everything. But sometimes you have to live your own life, and you have to, they have to accept the changes that we're going through.
And they also have to be kind with what you
Yeah.
say.
Yeah, so I think that's not necessarily just me as a celebrity, but it could be anybody who's in a high position job, who feels like they need to maintain that certain weight or a certain look, so it can be stressful. And this is why it relates to when it go to measures where they feel like, I need to take that injections.
I need to have that
I
surgery.
need to have that surgery. When maybe they don't.
I think you highlighted something so important, is that all our patients kan kalau mereka datang, I think it's important that they understand what's your intention.
Yeah.
We have to set the intention. Why you want to lose weight?
Yeah.
It's not sekadar, body image. It's not looking good, make me feel good. Some of them do say, make me feel good. I say, no, it's not about making you feel good because you want to look good, at a certain, time frame. You must understand that this health to benefit your health, which is in long term actually will spill over and gives you a good life where you will eventually feel good. And at the same time, saya selalu cakap dengan pesakit saya, as much as kita ada target weight untuk capai, I want you all to tell me when you feel good. If you feel good even though kita tak capai the target weight, I think that is an achievement on its own. And the way I support my patient is, I love to see them, once they've lost weight and they feel so good, they change their wardrobes and they come to a twirl. They're like, look at me, I look good. I think that is like, an achievement. And like you say, support. We all want support. As much as, you're in your celebrity position and you just highlighted such an important thing that people want you to stay a certain way. I think they are also human and they also must understand that
That's not fair.
it's not fair.
Yeah.
And we are all literally moving with age. We're moving with what's happening in our life. All of us have our own life.
Or we carry our own vacay.
Yes, everything might look nice, but we also have our own problems we're dealing with and all that. So yeah, you've just highlighted something so important.
And also, I want to say that obviously we're three women here. We talk, we discuss all these things on behalf of other women out there who might have the same concerns and questions. But what about the men? Do you think men think as much as women do about
Their weight.
kaitan and weight?
I will tell you something. This is literally just me being very open. Women are more stronger to accept kalau diberitahu you ada kencing manis, you got a weight problem. Lelaki is lelaki beremosi. Man, cry. When reveal that, I'm so sorry to say, but you are diabetic, and they cannot accept it.
Right.
Because I guess it's always been their nature to be the man of the house, stronger one and all that. But you can see the dynamics, and it's so beautiful to see the dynamic of the spouses in front of me, because the husband breaks down, the wife steps up. Then you see now, how the dynamic have changed, that the wife have become the stronger one in the family. So men as well, nowadays, they understand that, yes, being overweight, living with obesity is a big problem. And they also want to feel good, and they are feeling so much better and so nice. The tools I told, it's mainly the man that does. They're so happy and they're so proud of themselves because they've achieved something. So it's just like, it's amazing how to see even men. So it's not a gender issue anymore.
It's a human
It's a
issue.
human issue. Exactly. Yeah.
On a very, very, very last note, what about children? Should we address obesity and health issues?
Yes, definitely. I really hope
Umur
masyarakat
berapa tahun tu
tak cakap sangat cute, makanlah. Kita dekat orang Malaysia ni, apa yang kita suka makan? We've got apple of
It's a love language kan?
Yes, right? It's a love language. You go home, mak ayah, benda-benda yang berjalan, berenang pun atas meja. The fish.
Balik kampung kan, nenek masak.
You leave your atuk, your nenek, semua mereka pun, Allah, kesian, tak makan. Makan. So, they must understand that they must address the children also being overweight. It can be something from young, that means genetic, but it also can be the environment where they are staying. So, everybody's just like, feeding them and all that. So, it's very important parents understand that. I do get a lot, even though I'm an adult endocrinologist, I do get a lot of pediatric age group coming with overweight. And it's a bit difficult, I'll be honest, because it's difficult because I'm not only addressing the child. I can address the parents juga
Yes.
and their mindset, because I'm dealing with their child. And their love language is, okay, I will give you what you want, I'll feed you. But at the same time, there's another spectrum to it. Some parents are, like helicopter, like, cannot eat this, cannot eat that. And then, you also have obese, the one living with obesity and the one living with underweight. Two spectrum that I deal with as well. So I think we have to find a balance and the grab. Parents should stop their children from having access to Grab very easily.
Alamak.
Is that a problem?
Sebab si budak-budak order sendiri nak
Dia juga.
sebab anak
Anak sama sudah. Yeah, I think my son does right.
Yeah.
Yeah.
A lot of guilty charge. Yeah, order.
Jadi isu obesity ni dia bukan satu,
Not age related.
it's not age related, dan dia bukan satu yang kita snapshot. It is static in time, it's dynamic.
Yes.
And there's a lot of factors, family, especially when you talk about children, because I'm very passionate about building generation. I'm very passionate about raising children and, rising the next generation of leaders. Semua tu saya rasa, kadang-kadang baggage tu, ibu bapa punya baggage.
Yeah.
Kita punya mental, emotion punya baggage, kita kadang-kadang turunkan kepada anak-anak kita. Kalau kita pun ada isu dengan obesity, kita kontrol anak kita punya makanan. Ataupun kalau kita masih kecil, mungkin kita tak dapat kasih sayang dengan cukup, kita spoil anak kita dengan makanan yang macam-macam, anak kita obese pula. Jadi so it's true that you address not just the children but also the parents. And tapi klinik you mesti lama lah kan, instead of 15 minutes. Berapa tu?
Yeah, so my new cases usually is about 15 to 30 minutes.
So you double.
So kena, you go detail history, kena examine them and all that. But I think macam Fariza cakap, I think it's important that it is throughout the board. It's just not the pesakit. Dia bukan sekadar dengan your family, keluarga, but also government. It's also the schools. I think kalau we have more campaigns,
Policy makers, making awareness.
policy makers and all that, changing certain rules and all that, I think it's just a ripple effect that will make the nation a healthier nation. And if you look at it, obesity actually, if I may say, is not covered by insurance. So that's another thing about costs. So, then people find it difficult to approach to, oh my God, it's expensive.
So ada implikasi tak? Just getting a bit technical now. Yang semalam you kata government dah recognize obesity sebagai satu penyakit, sebagai satu entity. Jadi apa implikasi kepada healthcare dan insurers? Are we okay to talk about it?
Yeah, can. I mean, we should address
Yes.
it. Yeah, so we were addressing it also, yesterday. I think it's good that now there is a foundation already. So now there's support. The main people, the minister and all that, will start talking to the higher levels or the same levels of them in regards to the cost, insurance coverage and all that.
Yeah.
How this will impact. So dengan the insurance people, we are also trying to tell them that, imagine if we can tackle the root cause. The rest of the complication that you have to, kind of like
Daripada obesity tu cakap kecil manis lah, darah tinggi.
darah tinggi,
It will also drop.
everything will drop. So your payout also will be lesser. So it's actually a win-win situation if everybody works together. So that's how we're addressing it with that.
Yeah. So, what an eye opener.
Yeah.
What an eye opener.
The main question, the golden question is automatic. Antara kurus, cantik atau sihat?
Antara kurus, cantik, and sehat.
Antara kurus, cantik atau sihat?
Okay. I'm going to interlink. I'll choose sehat because kalau saya sehat, saya akan jadi cantik. Kurus irrespective. I feel I don't want to put kurus in this because I might even be overweight and I will still feel good. I think that's what will be important.
Okay. So maksudnya kita dah cover banyak ni. Thank you so much.
Yeah.
Thank you for having me.
Yeah. So, lagi satu, one of the conclusion yang I dapat ialah saya daripada kurus, cantik dan sihat, mental, physical and spiritual.
Yeah.
So, it's a new dimension of health. Bagaimana kita mendefinisikan sihat. Dan saya harap,
I think we are bridging scientific and quantum science. It's two things, So it's like spiritual, talking holistically rather than just being so scientific.
betul. Betul. Betul, and if we sebab kita pun umur-umur sebegini kan, jadi kita might have a bit more wisdom behind us, and we are going to hit 50 soon. 50 is the new 30, why not, so insyaAllah we have second chance at life but with more wisdom. So kita tengok balik macam mana kita memberi definisi kesihatan lah. Jadi so terima kasih yang tak terhingga kepada Malathi.
Thank you.
I will see you around at
Thank you,
work.
Sasha. Thank you for having me.
Terima kasih untuk pendengar kita sebab kita bukan saja menonton di YouTube tapi juga mendengar di Spotify. Jadi kami ingin mengajak lebih ramai lagi penonton kita untuk datang spread the word. Dan sebab dalam podcast ni kita nak membincangkan topik-topik yang heart to heart sebenarnya. Jadi kami mahu lebih ramai untuk menyertai kami dalam sebuah episod dan banyak-banyak lagi episod akan datang untuk membincangkan topik yang seterusnya dengan harapan ia dapat memberikan sedikit pencerahan yang dicari-cari. Sebenarnya macam itulah sebenarnya kita memulai sebelum buat podcast ni. There's a reason why we did it. Jadi terima kasih kepada anda yang sudi menonton. Terima kasih kepada Dr Malathi. Thank you so much. Dan kita jumpa di episod yang akan datang.
Jumpa lagi dalam episod Hello Sihat, apa khabar, dan teruskan usaha mencari makna dan erti.
Yes, be kind and always be there for each other. Okay.